Hello and welcome to Didactics Online. This is Masi Parker, and with the help of Tara and Wakhtar today, we're going to be talking about sacral diagnosis, the torsion edition. There's a few options for torsions. You can have a forward torsion or a backward torsion. Also, you could have a leftward facing or right facing. So we're going to break it down really simply. So you can have an LOL, so a left on left or a right on right. Those are your forward torsions. If a left on left is told to you, that's a left facing sacrum on a left axis. That's the abbreviation. Right on right would be the opposite. You can also have a backward torsion. You can have a left on right or a right on left. Again, that's just abbreviation for a left facing sacrum on a right axis or the opposite of that. There will be a few other videos we have on sacrum, some more diagnosis and some other fun ones you should check out. First thing I'm going to go over for sacral diagnosis torsion edition is going to be the seated flexion test. Go ahead and face the wall from Tara.
Okay.
This test is not too reliable. You have a bunch of soft tissue that can affect this. You have the QL muscle, you have the iliolumbar, the sacrotuberous, as well as the external rotators of the hip. But I'll just show it for completeness sake. In this test, you want the patient to be at close to 90 degrees at the hip and 90 degrees at the feet, at the knee, and at the feet straight on the ground. You're going to contact the PSIS bilaterally and have the patient flex straight down, making sure not to rotate to one side or another. The area that you have more motion on is the positive side for that seated flexion test. If she had more motion on that right PSIS as it moved forward, it would be a positive on the right. For torsion's sake, that will mean that we're on a left axis. You'll hear more about the other things for the unilateral and bilateral video. Go ahead and have those lay down on your stomach for me. Next thing we're going to talk about is the backward bending test. The backward bending test, again, tells you whether it's forward or backward. So that's the information we're after here. What you're going to do is contact the PSIS and move just in so you're on the sacral sulci. Now the sacral sulci will either be completely symmetrical or will be off. If it's any off, so if the right side is a little bit deeper, then what that tells me is that I'm looking to the left. If the left one's deeper, that means I'm looking to the right. So that's the information we're getting from that sacral sulci depth. Of course, we're on torsion, so we've already made sure that the ILAs are level, which they are. We'll hear more about that again on the unilateral one. So now moving on to that backward bending test, I have my sacral sulci palpated, and I know that the right one's a little bit deeper. I ask the patient to get up into the sphinx position, so extend backwards. Now what that does is as she's increasing that lordosis and backward bending here, that sacrum should be moving forward. But if there's anything tied up behind it, so backwardly stuck, then it's going to be stuck there while the other side moves forward and it will become more asymmetric. So if I have the sacral sulci becoming more asymmetric in this test, I know I'm backwards. However, if I'm stuck forwards and we backward bend and the sacrum moves forward, then we're going to be joining that spot that's already stuck. So in a forward torsion, we're going to become more symmetrical. So that's information you're getting there. So I already know what way we're facing, and after this test, I know if we're backwards or forwards. Another way to figure out if we're backwards or forwards is that lumbosacral spring. So go ahead and relax forward. If I come right off the lumbar onto the base of the sacrum, and I were to spring, sometimes I can spring like this, sometimes I can use my thumb to really localize it and spring. I'm springing. And if it's backwards at all, it's not going to spring. It's positive. Positive for pathology. She's stuck. She won't spring. I know that it's a backwards torsion. You have L5 here. Sacrum comes back and will not spring forward. However, if it was a forward torsion, I can come here and it'll feel like it will spring. So if I get some good springing here, that's a negative test, meaning it is springing, and I have a forward torsion. Moving on to respiration. In respiration, it's a little bit more complicated, but basically the free side of the sacrum will move more than the restricted side in the normal respiratory motion of the sacrum. Moving on to a personal favorite of mine is the four-pole springing. I'm going to use a little diagram here to help me with this diagnosis. What we have here are four poles. We have the superior poles, the sacral sulci, and the inferior poles, the ILAs. What we're going to be doing here is springing on all four and finding which one is the most stuck. In most cases, there will be a couple, most likely two, that are stuck, but one of them will be more stuck than the others. So what we have here, we come down and we spring on all four. So if I spring on the two ILAs and then come up and I'm springing on the two superior poles, again, it's a little bit more helpful here to localize and maybe use one thumb and spring on that. It's giving me a tremendous amount of information just by finding out which is the most stuck. So let's break it down here. If I have a left on left, so here's my left axis, and I want to look over there to the left, please take a look at our bonus sacrum dance done by Rob for some more information on what these actually look like. But a left on left, what is the most posterior is that left ILA. So that will be the most stuck, and right there you have it, left on left. In another case, let's say that we're on a right axis, but we're looking to the left. Now you know that the two letters are opposites, you know it's a backwards torsion. So we're right on left. What's the most posterior? There you have it. We have a left on right, a left facing sacrum on a right axis. Another way you can think about this is break it up into two different pieces of information you're looking for. I want to see if it's looking to the left, so there you have your left facing sacrum, that first letter, or looking to the right. There you have the right facing sacrum, the first letter again. Then another thing I want to see is if it's forward or backwards. So if it's a forward torsion, then that lower area is going to be more posterior, and there you have it, same letter, forward torsions. However, it's a backwards torsion, the posterior aspect is going to be up at the base, and that's going to be right up here. You have different letters, backward torsions. So you can break it down either way. You can see whether it's looking left, right, and then forward, back, or you can go straight into these four poles. Sacrum can be a little bit confusing, so we're going to have multiple videos on this, but as always, if you have any questions or comments, please comment on YouTube or didacticsonline.com.